I thought, what would be better than to use my 34 years in the veterinary industry than to help you guys, the pet owner? What are your questions? What do you need to know? What would you like to know? I want to create a completely interactive podcast where you, the listener, can ask your questions and we will answer them. I will have industry leading professionals come in and have conversations about your very questions. What keeps you up at night? What worries you about your pet? What worries you about the cost of taking care of your animal? There's so many things that we can talk about, but I need you to tell me what we need to come up with. Because if you do that, we can have a great, great, great session. Wow.
But I don't have to buy 10 of them.
Yeah, that's true.
But that's also, I'm still photography and action sports.
Yeah. Oh, yeah. Action sports photography. Adam Gassel.
That's right.
Hello, everybody. Welcome back to another episode of Irreplaceable Tails. We have Dr. G, as usual, here, and then we have our specialty doctor, Dr. Gassel, here today. G, I will let you introduce Dr. Gassel.
Well, Adam.
Hello.
How are you?
Good. How are you?
Dr. Gassel, probably one of the best surgeons I've met ever.
Dr. G, as usual,
and very excited to have you on the show for our first live episode.
All right.
He is a orthopedic surgeon, so we have a lot of questions that you've been asking about limping.
Yeah.
So we're going to have a fun limping episode. So
right.
Please, as you listen to us, let us know where you're listening from. Let us know what questions you have. We're going to try to answer them. We have a list of questions from before, from our posts, but we would love to get some live questions too. Anything you want.
All right. And just a reminder to everyone, while we love discussing animal health and pet care, this podcast represents just their opinions. We are not diagnosing, treating, or trying to give medical advice for your individual pets. So, but these are questions you guys have submitted, so hopefully you get some answers. All right. The first one we had was, my dog is limping, but it comes and goes. How do I know if it's something serious?
Yeah, good question. I think typically if a lameness is persistent and there all the time, it tends to be something a little bit more, I don't know if serious is the right word, but something that should be addressed. Just like in people, we can have aches and pains. We assume that our furry friends can exhibit the same sort of syndromes. So, I always tell people that if your dog is limping or holding its leg up or acting abnormal, then it's something that's bothering them, because otherwise they would use all four of their legs if they had the ability to do it pain-free or function-free.
Can we debunk a myth right now?
We could try.
Animals do not really want to show pain, correct?
Instinctively, probably.
Instinctively, they do not, because as far as things go, the biggest problem with dogs is they still have that Mother Nature instinct, which is if they're the alpha and they show any weakness,
Sure.
they fall on the food chain. Yeah. So if a dog is intermittently limping, there probably is something. It could be soft tissue, it could be joint. We just got to kind of figure it out. And unfortunately, that means x-rays.
Typically, yeah. I mean, I think the first place to start is a good examination. And I think it's helpful for pet owners as well nowadays, because we have the ability to do so with all of our fancy phones, is video what you're seeing and bring it in to your veterinarian. Because, just like when you bring your car into the dealership, it never makes the noise that you hear it making.
Well, especially with intermittent limping too, right?
Yeah.
If they're worried about intermittent limping, you're probably not going to get into the doctor the day that your dog decides to limp, right?
Yeah.
So
Videotape it.
yeah.
Yep.
Back to
Videotape
video.
Yeah, take
it.
advantage of your phones.
Yes, that
Video
the magic box that talks to the sky. Yes.
Yeah.
This person said their vet had mentioned hip dysplasia. What signs should they be looking for, and when do you typically recommend surgery?
So, hip dysplasia is a congenital genetic disorder. It's there, since birth, and it can become a progressive problem. So there's different degrees that they can affect. It can affect your dog. So early staging, early viewing, early diagnosis can be very beneficial. Clients act surprised when they bring in their limping 9-month-old dog and they can't believe that its hips are a problem. But that's typically, the earlier you can diagnose that, the more potential treatment options you have to save the joint. And so, I think early screening, it can be ideal, especially in our purebreds or breeds that are predisposed.
Would you suggest maybe screening earlier on larger breed dogs versus smaller, or to be more aware of it, I guess, in larger breed dogs versus small breed dogs?
Yeah, 100%. And I think people are unaware that, they go, well, I spent this much money on getting my purebred dog.
Right.
They showed me that, they're AKC certified. The parents have been for generations great. What people need to understand is that hip dysplasia is what we call a polygenetic problem. There are multiple genes that code for that problem. So yes, you can have litters and litters of normal, healthy dogs that never exhibit signs of hip dysplasia, develop hip dysplasia, but the genes are hiding within that line. So eventually it can show itself.
And genetics is like roulette, right? It's you never know how it's going to hit.
Yeah.
You never know how it's going to hit. So I mean, there could be complete lines of a litter that have horrible hips.
Yep.
And then another line, same mom and dad, perfect.
What do you think about when people are doing OFA certifications? Do you think that that helps out all organtists kind of go back to the roulette of the gene pool?
No, I think it does help. I mean, if you've got two OFA certified parents, your chances mathematically are better that they're not going to then breed dogs with a problem. They're less likely to be carrying those genes for hip dysplasia. But early screening, early detection, early screening, there's a better diagnostic way to do it radiographically through a PennHIP study. You can do those up at 16 weeks of age and can be suggestive diagnostic of hip dysplasia, whereas OFA, they won't certify you till after 1 year.
So you could potentially start screening as early as 16 weeks for people who are concerned or something that they...
Yeah, and OFA is the Orthopedic Foundation for Animals. It's a wonderful organization. They mean to do well, but again, when you're talking about X-rays or looking at a mom, the bitch or the stud's X-rays, it's their X-rays. You don't know their genetic, makeup.
Correct.
They could be carrying those genes.
Yeah, and so OFA is just a radiographic appearance that those hips look normal according to a radiologist based on certain criteria and standards that they're looking at.
Right.
PennHIP is giving an objective value to your dog's hips. And what they do is if your dog, let's say, is a golden retriever, you get a PennHIP score. It goes to the University of Pennsylvania where they have an entire library of golden retrievers. And based off your dog's distraction index, that will be compared to what their library of normal is and their library of abnormal. So then they'll send a report back saying your dog has a certain % chance of developing hip dysplasia based on their individual distraction index.
Oh, wow.
It's still not 100%
Yeah, but still better than...
accurate, but it gives you a good idea. And then at least if you're doing that at 16 weeks of age and it's suggestive of a problem and your dog is not exhibiting any of those clinical signs, at least you know to start following up monthly or every 2 months so that you can get that early detection and just leaving your options more available in what you can do. And
PennHIP and OFA are usually sedated X-rays.
Yes, always. Yeah. And you have to be PennHIP certified because there's certain positioning that you're required to learn.
Are you certified?
I'm not certified.
You're certifiable, but you're not
certifiable, but I'm not certified yet. Absolutely.
My dog was just diagnosed with a torn cruciate ligament. Are there any treatment options besides surgery? I've seen knee braces for dogs with torn ACLs, but do they actually work, or is surgery a better option?
Yeah, great. I think when it comes to torn cranial cruciate ligament in dogs, if they are healthy otherwise, no other comorbidities or reasons they can't undergo anesthesia and surgery is always going to be the best option because it's going to fix the problem.
Right.
Knee braces are out there. People just have to understand that braces are going to mitigate some of the discomfort, provide better stability of the leg, but they're not going to allow things to heal. Dogs with cranial cruciate ligament tears try to heal the leg by building up scar tissue, but it will never stabilize that joint completely.
And it'll become arthritic a lot quicker.
Yeah, there'll be progression of arthritis. Torn cruciate ligaments are not a life-threatening injury in dogs.
Right.
You go to Huntington and the dog beach, you'll see plenty of dogs running around with
That's where my
Torn
dog tore her
cruciate leg.
cruciate, was
Yep.
at the Huntington dog
Well,
sheet.
so let me ask you, where's the most common places you've heard people have their dogs tear cruciates? The beach?
Beach, dog park, but it's, those dogs are probably going to be more prone to doing something because tend to be athletic, young dogs.
Yeah.
Larger, running.
Right.
They think the mechanism most commonly is stepping into a divot or defect in the ground that causes hyperextension and internal rotation of that joint. So commonly, if you have that dog that wants to sprint at 100 miles an hour, try to turn on a dime, that's really going to set them up.
All dogs are athletes. So, I mean, what you just basically explained was a football player, a volleyball player, a basketball player, a skier,
Yep.
a women's soccer player. They're really prone, all those. So it doesn't matter their size, because I've seen ACLs or cruciate ligament injuries in every size of dog.
Yep.
Yeah.
Is there a breed that's more prone?
Sure. Our female middle-aged Labradors are probably the poster child.
Yeah.
How about
Our
American?
pitties.
Yeah, pit bull terriers.
Yeah, we
Yep.
see, now that every other house owns a French bulldog, we're seeing a lot more Frenchies with knee issues. They tend to be more patella issues, but certainly seeing more cruciates in those guys as well.
So, and also on the Frenchies, though, the patella, the kneecap, when
Yep.
it comes off, you lose the stability of that knee.
Yeah, it's part stability, true, because it's a pulley system, but also when that kneecap comes out, it causes internal rotation of the lower leg bone, the tibia, and that puts the cranial cruciate ligament under what we call the femoral condyle bone in the femur, and it can put stress and pressure on there and can start to cause fraying or damage to that structure too, which is why we'll really push for dogs to get their patellas corrected, because it decreases the risk of them subsequently tearing the cruciate ligament.
Yeah, I mean, I was lucky enough you did 3 knee surgeries on my one dog, 2 for cruciates. And I think people kind of get worried about the cost.
Sure.
But I did them, and we never had an issue. I think the first one she was 4, second one she was 6,
Yeah.
and she was almost 16.
Yeah.
And we had 0 issues with it. So I think if it's done right and you can afford the surgery, it's an amazing, amazing surgery to be able to provide your pet.
So let me ask you this question. If my dog tears one cruciate, what are the percentages that the second cruciate is going to go?
One study looked at purebred Labrador retrievers. They ended up with about a 30 to 32% chance that within 6 months to a year they would tear the other side. What they called all other breeds, so non-Labrador breeds, they found about a 28% chance. I think some people would argue, and I probably would agree, your Labrador that comes in that's 3 to 5 years old and tears one, there's probably more of a 50 to 60% chance.
Yeah.
They're going to tear the
Yeah.
other one.
I feel like we always
Because it
saw
doesn't
repeat
change their
offenders.
behavior.
Yeah.
It
I feel like we
change.
always saw repeat offenders with that, right? I mean,
Yeah, it really is. And then I tell people once you've done 2 of them, you're out of knees. So
Right?
That's good.
It's the
There's
good-
a silver lining.
It ends at some point.
Yeah.
Now, there's a lot of literature out there, and I've read it online with the dog websites and stuff. What's the science behind the angle of the knee causing cruciate rupture?
Yeah, what they're referring to is the slope. So the tibia, the top of your tibia. In humans, we sit at somewhere between 3 and 5 degrees of a slope from the long axis. Okay, in dogs, their average is somewhere around 22 degrees. So they're sitting back like this. Their natural force in their knee joint is, to simplify it, is going back towards their tail. Okay, our overall force vector in the human knee goes straight into the ground along the long axis of the tibia. So that shear force that's there all the time, as long as all the ligamentous structures are intact in the dog's knee, everything works great. As soon as that cranial cruciate ligament starts to deteriorate or break down, it can't overcome, and that shear force becomes more significant.
And that's why people can walk around with torn ACLs as long as they're not
Big
going to go
reason.
play, not go
Yeah.
play football or
Yep.
beach volleyball or something without a problem. But with dogs, it's all the physics behind the knee.
Yep, and relatable to why we fix them the way that we do in certain instances.
Do you feel like you're typically plating and screwing with every TPLO, or?
It's become a lot more commonplace. I mean, originally when they developed the TPLO, tibial plateau leveling osteotomy was designed for our larger breed dogs, and they only had implants compatible with, medium to large size, extra large dogs.
Right.
Now they're available. I think the smallest dog I want to say was around 8 pounds, 8 to 10 pounds. So, tiny bones, tiny plates. But yes, I think
smaller screws.
Yeah,
I think thinking of the screw size. Wow.
Over extracapsular suture repair, I think return to function is much quicker. Decreased progression of osteoarthritis has been shown to be less with TPLO or other what we call osteotomy techniques.
This one's pretty repetitive. It just kind of said, I've heard about TPLO surgeries for knee injuries. How does it work and what's the recovery like? So I guess the recovery we could touch base on.
Yeah.
It's a pretty extensive recovery. It's not an easy recovery for the owners or the pets, right?
Yep. Yeah. I tell everyone the surgery is the easy part. The aftercare is the hardest because it's new for everyone typically. So I tell everyone, you're looking at the cone of shame for 2 weeks, so they're not licking or chewing at their incision.
Very important because you do not want to get that plate infected.
Correct. And I tell people to hang their bill or their invoice all over the house so it reminds them to be good about putting the cone on. It already cost enough.
Right.
And then first 4 weeks, I just say doggy jail. No running, jumping, playing. If your dog is crate trained, put him back in the crate. If they're not, sometimes that can be more detrimental because they're digging, pawing, freaking out. It's better just to have them by your side. And then at about 4 weeks, we're typically taking an x-ray to make sure that the osteotomy, the bone cut that we've made, is healing appropriately. Take a feel of the leg, watch the patient walk around. And then we start 15, 20-minute leash walks twice a day, typically a final set of x-rays at 8 weeks, and then again, continued slow return to normal function. You just can't ask your dog to only go 40%. They either go 100% or they're
or
sleeping.
not at all, right?
Yeah.
Yeah. So, there's always better living through chemistry. If you have that crazy lab, that 3-year-old lab, right?
Yep.
There's nothing wrong with that. Just keeping them quiet. There's no long-term effects. Just to keep them kind of calm and mellow, because if there's something that goes wrong with that leg,
you don't want to do that.
Yeah, you don't want to. You don't want to go down that route.
No, you don't. And I'd say, along those lines, people always ask, yes, they keep the plate as a souvenir for the rest of their life. It's, I'd say it's less than 3% of the time we need to go in and take that implant out, either for potential infected-related implants or just irritation from the implant itself. Sometimes the patients just don't tolerate it well, but it's pretty low.
How many animals have you seen have an allergic reaction to the plate?
No, I've never seen any personally.
Okay.
It could have been, I guess you could argue if the plate you take out and you culture it and it didn't grow any bacteria, and so then you think, well, the plate was irritating them. Could you argue that's an allergic reaction? I guess, but all the plates are typically 316L stainless steel, inert metal. There is an implant system that uses titanium, which is even less reactive.
More expensive.
More expensive, yep.
Yeah.
Yeah.
Have you noticed a difference between the two metals or using the two different metals?
No.
You've seen about the same results?
Yeah, and again, the titanium was developed for a different osteotomy type surgery called a tibial tuberosity advancement, which I have, TTA, which I have performed. Then you get into a whole realm of TTA versus TPLO, and
it's a whole new.
That's a whole different podcast.
That's a whole different spiral.
Yeah. The TPLO is better, in your opinion.
For certain applications, yes. I think there's still an argument for TTA in certain cases. But overall, I find that TPLO kind of checks all the boxes and is applicable to all the patients that I've come across and treat.
Okay.
This one's a pretty general surgery question. It just says, my dog just had surgery. They didn't specify what type of surgery. What can I do to make sure they heal properly?
Follow the directions of the surgeon. Again, almost all surgeries are keep your dog away from the incision site, keep it clean and dry, and keep them calm and quiet to allow healing. If it's a soft tissue surgery, you're talking probably 2 weeks of healing time in most cases. If it's an orthopedic procedure, then most of the time you're talking 6 to 8 weeks, probably average.
How do you feel about when owners come in and they have like all that goopy medicine all over the incisions because they've been trying to help it heal. They,
Yeah.
they're dumping Neosporin on it, cleaning it with hydrogen peroxide.
I try to talk to them and let them know that it's typically not necessary. That if they're just keeping them in a clean environment, that's enough. And we try to teach them and write down what signs to look for that would indicate potential infections so that you're not creating resistance unnecessarily with different topical antibacterials and things like that.
What are your red flags for incision sites?
Redness, swelling, warm to the touch, any sort of oozing or discharge.
Sutures coming out.
Yeah.
Sutures or staples missing.
Yeah, missing. I swear we kept the cone on.
Yeah.
Yeah, right?
Yeah, I mean, the thing is, being a realist and, as far as the cone goes, when if the owner's asleep, the cone should go on.
Yep.
If the owner's going out for even a minute, the cone should be on. Yep. If you're going to sit there and watch a TV show and your dog's going to lay there and you can watch everything, then and cats too.
Yeah.
Yeah. Cats are even worse at getting those incisions open than dogs.
They are Houdini.
Yes, they are.
Yeah.
Because they want to take over the world.
Yes.
Yes. But, you just got to watch because trying to heal an infected, inflamed incision is 3 times as hard.
Yeah.
It takes forever.
Yeah. And it's unnecessary.
Yes. And painful.
Yeah. Costly, painful.
Yeah.
And they're quick too. I mean, you can, like you said, like 1 minute, like you can go into the kitchen and come back and those incisions are wide open. And make sure you can get your cone back on, right? I think a lot of people take the cone off because they're like, oh, my dog's miserable. And they come in 2 days later and they're like, I have been trying for 2 days to get this cone back on and I cannot get the cone back on my dog. So make sure if you take the cone off, you can, get it back on.
So what do you think of those soft cones
Yeah.
or the neck
The
collar?
donut.
The inflatable kind of donut ones, I think depending on your dog's nose and conformation, can be just fine. That's really key. I just tell clients, if your dog's nose or tongue can get to the incision, it's a problem. Personal preference, I don't like the papery soft cones.
Yeah.
Because they can just push them onto an object and they fold backwards, and now they're not doing anything. So the hard plastic cones, they're terrible. My dog actually has one on right now. I've got bruises across the front of my shins. I've got marks along the wall, but they do work well.
Yeah.
The biggest issue with those inflatable ones is that clients fill them up too much air.
Yeah.
You're only supposed to inflate them halfway.
Yeah. Yeah.
We had the one dog, remember, he came in and he was wearing it like a tutu. It was like all the way down on his abdomen. And we were like, no.
That's not how that works.
That's not where it's supposed to go.
Okay, let me ask you a question since you're here. What if you did surgery on the front of the dog and it starts nailing it with the back foot?
Yeah, those are difficult. So sometimes we'll go to putting some sort of protective bandage or wrap over the front to protect it, or some sort of sock or material on the back foot that's causing the problem. You can hobble dogs. You can get to extreme things.
Right.
Yeah.
But,
Well, what I used to do is I used to have clients put a T-shirt on their dog.
Sure.
If it was up front.
Yep.
And just say tie it up like a Hooters waitress, and it would work.
Yeah.
Yeah.
There's stockinettes and T-shirts work great for depending where the incision is. A lot of times you're dealing with behind the front leg, like at the elbow level, and a lot of times the T-shirts just won't reach there.
Yeah.
So.
My dog has a lump. How do I know if it needs to be removed?
Yeah. It needs to be sampled.
Yeah.
So, your veterinarian is, equipped and ready. Put a small little needle and take some cells out and start there. See what it shows. Sometimes it does end up requiring a biopsy, which is a full thickness tissue sample to identify whether there is something more concerning.
And my recommendation always to owners was if I need to go in and biopsy, why don't I try to remove it?
Yes, I don't disagree with that depending on what you might be dealing with and the approach. Because some tumors that we deal with are malignancies. Your best chance at curing it is your first chance at surgery. So, if, someone else kind of messes around with it, then it can make the second time having to go back in a little bit more difficult.
Because you don't know the margins? You don't know the scar tissue everywhere?
Yeah.
Yeah. I mean, my dog had another surgery I forced you to do. My dog just had a benign fatty lipoma.
Yeah.
But we removed it because I thought she looked like a hunchback. But also, it was under her scapula area, and it was painful for
Yeah.
her, and it was impeding movement.
Yeah.
So that's something they can always go off of too, even if you do end up with a benign mass, if it is impeding movement or if it is uncomfortable.
Yeah.
You can always,
Yeah, because
you know.
if it's benign, it's more of an elective thing. As
Right.
long as they're not growing quickly, as long as they're not painful, as long as they don't change color, as long as it doesn't interfere with the dog's quality of life.
Yeah.
You just watch them.
My dog bloated once, but recovered with treatment. Should I consider preventative surgery to stop it from happening again?
Yeah, it'd be interesting to know what breed of dog it is and how deep-chested and some other factors that contribute to the risks. Because bloating, we know, is the predisposing condition to then torsing, which is a different problem. So
I think people confuse that too.
They do, because you can get food bloating, you can get bloating from
Water.
water bloats, you can get air bloating from you're in respiratory distress or they're overheating and they're just sucking in a lot of air that way.
Yeah.
So bloating, the condition is where the stomach is just dilated. The risk becomes then if the stomach twists on itself, that becomes a life-threatening situation. And so to really answer that, I'd be curious to know a little bit
More about the-
more information. But
Yeah.
if your dog is breed predisposed for what we call gastric dilatation volvulus, then yes, prophylactic gastropexy or a tacking of the stomach to prevent that from happening is a good idea.
And I was one of those veterinarians that always would recommend, if you do have that bigger breed dog, deep-chested dog, at time of spay or neuter,
Yes.
do an elective gastropexy. Just go in there, and what you do is you tack the stomach down, so if they do bloat, it won't twist. Bloating still is a life-threatening emergency.
Yes.
But the twist is like you need to be calling your veterinarian on your way to the hospital.
Yeah.
Yeah, the survival with bloat, we know if it's identified within 6 hours and addressed, the survival rate is much higher than once we get after that.
What are your big red flags for bloating when you hear people calling on the phone saying my dog is doing?
They're standing in the praying position. Their abdomen may actually look very distended.
Swallowed a beach ball.
Yeah.
And they're usually retching, non-productive vomiting.
Are there currently?
But let's get back. And also, though, even if you do get in there within the 6 hours to fix a
Sure.
twisted stomach, still there's no guarantee that they're going to get out of there because you start releasing all these heart toxins once you twist it,
Sure. Yep.
right?
Yep.
And then also another problem is if the stomach was twisted too long, there could be some necrosis
Yep.
or the tissue's dying. The spleen could become a problem. It could have lost blood supply. The kidneys lose blood supply with that twist. I mean, there's a
Right,
lot
because you have
goes
that
in.
major artery, right?
They're
That runs
typically
along.
they're treated for shock, and so all the stuff that goes along with post shock, you have to be ready to deal with. So it can be. It is certainly a life threatening situation, and the early intervention is key for all the reasons you're alluding
The
to.
elective gastropexy.
Yeah.
Yeah, think about getting the dog's stomach tacked
Yeah.
at spay or neuter.
And like you guys said, it's those typically the large, deep-chested dogs that we
Yep.
see
What's
it
the
in. So-
smallest dog you've had bloat?
It was a smaller Bernese Mountain Dog.
We had
Smaller size though.
I had a Springer Spaniel.
Yeah.
Yeah.
I had an 11-week-old bloodhound,
Okay.
and then I also had a corgi.
Yeah.
So
Little lowrider.
yeah, the low rider.
Are there any supplements or diets that actually help with joint health, or are they just a marketing gimmick?
No, there's good supplements that are out there. I think, when we get into this whole idea of nutraceuticals, even on the veterinary side, it's very similar to what we deal with on the human side. I typically tend to recommend Adequan and Cosequin at my go-tos because they've actually studies have been done,
Right.
scientific studies to look at their efficacy.
Right. Actual research.
Yeah. Again, if you walk into Costco or GNC or someplace else and it's, some natural remedy, could it be beneficial? Certainly. Is there science behind it? It hasn't needed to be performed.
Are
in
there
order for
side
them to
effects
sell
in
it.
the dog?
Yeah.
You don't know.
Yeah. And it really, ingredient label reading, making sure there isn't something in there. But, green lip muscle and all that kind of stuff is great.
Well, the other thing is also when you go to GNC or any health food store or even Costco to buy glucosamine, there's a price range.
Yeah.
And there's a reason why.
Sure.
The cheaper glucosamine, yes, it's cheaper, but it usually comes out in the poop.
Yeah.
Right?
So the absorbability of it.
Yeah.
What's, what's available. Bioavailability is
Are you a fan of Missing Link?
I don't have an issue with it.
Okay.
Yeah.
Yeah, I used to use Missing Link because you just put it on the food.
Yeah. I mean, again, and for a while, Dasequin had to be prescribed.
Yeah.
To get it, and then that went away. I honestly don't know. I'd say at least 5 years ago, if I'm guessing. So and they started selling on Amazon. It's super easy for clients to get. There's a loading dose for the first 4 to 6 weeks. It's all on the bag. You can either get it in capsule form, or they have these little biscuits that some dogs really like, so they feel like they're getting a treat.
Yeah.
And so it works out great.
And then also, what do you think of MSM, monosulfoxymethane?
Yeah, all of it. I mean, I think if you can get an all-in-one, great.
So glucosamine with MSM.
Yeah, omega-3s.
Yes, not salmon. Salmon oil doesn't do
yeah.
anything. Dogs can't digest salmon.
They just end up smelling fishy.
Yeah, they
Yes.
smell fishy. And
Yeah. And then the other thing I was going to bring up was with the nutraceuticals. Whenever you start a nutraceutical, it takes at least 6 to 8 weeks to truly see a difference.
Yeah. And I sometimes it comes down to one of those things. It's very hard to measure what kind of improvement outcome that you're seeing. I kind of am a believer when it comes to that it's not going to hurt. It has the potential to help. So then it's just hitting your pocketbook.
Yeah. I want to ask you this one question that just came up, but have you started using Librela yet?
Yes.
How are you feeling about Librela?
I've been pretty selective on my use of Librela.
Yeah.
Because of some of the warnings that have come out. The FDA came out with a big warning, I think.
What is
2 months
Librela?
ago? It's a monoclonal antibody, right?
Okay.
That's a pain receptor blocker.
So you use it for arthritis?
Pain associated with musculoskeletal is really what it is indicated for. So I, knock on wood, I haven't had any problems with the select patients that I have used it in. I want to say I'm at probably 25 dogs or so.
Yeah.
I do warn clients, and part of our job is educating people, obviously, and letting them know what the potential harmful side effects can be. And so I really had those discussions when it comes to Librela with my clients and what to watch for, and that they know. I said, hey, it's been out for a long time in Europe. It's more recently been approved in the United States, and so we're just not there with case numbers yet.
Yeah.
And then be careful what you read.
Right. Right.
Dr. Google is a scary thing.
Yes.
So we had someone ask a question. I have a 7 or 8 year old pit mix. What can I do to avoid any mobility issues as he ages?
Weight. I think keeping them in good condition. I always tell people, think of your dog the same way you think of yourself. What's going to allow you to maintain mobility, flexibility, comfort, things like that. Well, maintaining good diet, good nutrition, good health. Let dogs be dogs.
Yeah.
I mean, yes, throwing a Frisbee and running them at the park and agility training, are you going to predispose them to an injury just like you would yourself?
Right.
Yes, the risks are going to be there. But at the end of the day,
I know at my age right now, I'm a hamstring away.
Yeah. I mean, when they start allowing pickleball in animals, it's going to be...
It's over.
It's over.
It's over with.
Over.
Yeah, I'm a big believer in swimming animals.
I was just going to bring that up.
Yep. I tell people all the time, if your dog can swim and you have access to a pool, fantastic. It's when they're in the water, it's great. Then you got to be aware when they're getting out of the pool, what are their behaviors like, and trying to train them not to act super silly and goofy and
slip on the pool
Tear
deck,
around.
fall back in the pool.
Yeah.
I mean, I've had it all, but no, I'm a big believer in swimming.
Yep.
Yeah.
Also, another great exercise for these guys is you keep them on the leash, and if you have hills, walk them uphill.
Yeah.
Sure.
It's just a little more, it's a little more exercise behind it. It depends on where you live, right? I mean, we don't have the back 40 like they do in a lot of parts of the country.
Yep.
And so here in, where we are in suburbia, we're very limited with our space. So swimming, walking uphill if it's available, exercise is key, obviously.
Yep.
But you have to do it in moderation, and you just got to be smart about it.
Yeah.
Like Dr. Gassel said, would I go diving for a Frisbee right now? No.
I can't even get off the floor
It
anymore.
wouldn't be pretty.
Yeah,
This is kind of related to this as well. It says, if my dog has arthritis, would something like physical therapy help keep them moving? I've heard that dogs can do physical therapy. Does that really help, and what does it involve?
Yeah. They're going to, put them through specific modalities and movements that they feel are safe for whatever injury or joint issue that your dog is dealing with. And like Dr. G alluded to, a lot of these physical therapy places now have what they call an underwater treadmill. So they can put a flotation device on your dog. They're on a treadmill, but it's with water support. And so that is, it's really, really helpful. Then you get into cold laser therapy and red light therapy and all those other things too that are,
Have you seen those really fat cats that they put on the underwater treadmills to get them to lose weight? I love it.
Yeah.
I love it.
Oh, I was going to ask a question, but my age caught up with me on that. Going back, physical therapists. How about chiropractic?
Depends what they're doing. When I have seen, this was more in my residency because we had to cover part of the neuro service, and we'd have dogs that come in with potential back issues, intervertebral disc disease, neck issues, and I'd have clients that would come in and say, well, I'm going to go to the chiropractor next week. That makes me nervous because of what they may be adjusting and putting at risk.
Yeah.
So,
their anatomy is a little different when it comes to the back, especially.
Yeah.
But, chiropractic, as long as it's under close veterinary care, I think it's okay.
Yeah.
I think going to a chiropractor's office isn't good. I mean, I've seen some amazing chiropractic stuff on animals, and especially on horses.
Yeah.
Yeah, right?
Yeah.
But you're out of our realm when you're talking about
Yeah,
the big,
we
the
have
big ones.
we have an equine gal coming in, so don't worry. You guys are there. I don't have any equine questions for you guys.
Yeah, but the limitation, I think that's, if they're dealing with an underlying neuropathy, then that would concern me.
Yeah.
Just with doing manipulations
So
of the spine.
any neurological sign. Basically.
Yeah, because especially if they don't really know what's causing the sign, then you're really putting them at risk for potential problems.
What about flooring types? Are there any certain types of floors that are better for dogs with joint issues or dogs recovering from surgery?
Yeah, non-slick flooring.
Yeah.
And most of us nowadays either have concrete, tile, hardwood, all slippery
All
surfaces.
the slippery floors.
I mean, not many people have carpet anymore.
Yeah.
And so what I'll tell people,
go to Walmart, buy some throw rugs.
Yep. Yep. Either yoga mats, like the little thin yoga mats, you can put down, or I tell people post-surgery to put them in a safer place while they're recovering is, like Dr. G said, is just buy some throwaway carpeting and just put it all over the place.
What's your opinion on the orthopedic dog beds?
Great.
The egg crates and all that stuff?
Yeah, if they can get in them and they'll use them. What most clients tell me, I went and spent $200 on this beautiful bed that even I would sleep in, and my dog wants to lay on the concrete next to it.
Yeah, it wants nothing to do with it.
Well.
And you worry about soft surfaces like those beds and stuff. You don't want them in their crate post-op, right? Because you want them to be on harder surfaces where they can't re-injure.
No, I don't worry too much about that.
Okay.
I think if it's a good, reputable, like orthopedic bed, I mean, we keep those in the hospital and recover patients on floor recovery all the time.
Okay.
But we're not, I try not to bunch a bunch of bedding so their feet can't get caught up in material.
Right.
So a nice tight fitted sheet is fine to put over top of that. Yeah.
Nice. We used to have clients that would go to Home Depot and they would get that like roll of runner, and you can cut it to any length, and you would go to their house and they would just have like
runners everywhere.
Runners just everywhere, but they stick to your floor on the back. And
if you have OCD, it's not going to work.
No, it's not.
it's not
Oh my God, getting things to line up.
Yeah, there it is. You got to match the pattern.
What is the most challenging surgery you've ever done?
Ooh. I would say what comes to mind, I had to do a tracheal resection and anastomosis in a bald eagle.
Oh, that's cool.
Yeah, it was.
Was that during vet school?
No, it was here. Dr. Scott Weldy.
Oh, yeah.
Brought the eagle in. He had developed what's called a fungal granuloma.
Okay.
So an obstruction in the trachea. And so I said, how many rings in the trachea can you take out in an eagle? Does anybody know?
Right. Is that the one that lives at his practice now?
Did you
I think his name's
Google?
Billy.
Did you Google that one?
Yeah.
Did Google have an answer for that?
No, they did not.
ChatGPT.
Yeah.
How many rings did you remove?
He told me just enough. So,
Yeah.
yeah. I think it was probably 10 rings. I think we ended up, it was, but enough to where,
Did you do a graft afterwards?
No. You just suture it back together, just like taking out a piece of bad pipe.
It's amazing.
Unbelievable.
But that's what comes to mind.
Yeah.
Yeah.
No, that's super cool.
Unbelievable.
Yeah, it was wild.
We've never.
It's a bald eagle.
Yeah, it was cool.
Yeah.
Wow,
that was amazing. Yeah.
Is it I mean, I feel like I worked in zoo. I'm not a fan of birds. They are terrifying. The talons, the claws, the beak, the screaming, all of it.
Yeah. The great thing is when I get to them, they're asleep.
They're out, right? Yeah, your text dealt with all of it, right?
Yeah.
Yeah, the postoperative care on an eagle. I mean,
Yeah.
No,
can you imagine putting an e-collar on that thing?
Yeah, no, I think that's where you go to thoughts and prayers, right?
Yeah,
You're just
exactly.
like, here we go.
Yeah, here we go. Hope for the best.
Yeah.
Last question. What is the biggest misconception that pet owners have about orthopedic or soft tissue surgery?
That if they spend enough money, everything will be fixed.
Yeah.
Everybody's doing the best that they can. Everyone's intentions are good.
Yeah.
Nothing ever is guaranteed. And so I think that's the biggest frustration. And I understand it.
Yeah.
90+% of the time, a lot of these procedures go great. Dogs live a great life, and that's our goal and what we're trying to accomplish. But I think maybe that's the biggest misconception is, you're not fixing a tire.
Right.
So.
And I think sometimes coming from the general practice side, I think clients wait too long.
Yeah.
Right? Like if there's something that you're contemplating doing, do it now.
Yeah.
Don't do it in 6 months because that's technically 2.5 years of human life.
Right.
Don't do it a year or 2 years down the road because you never know what's going to happen.
Yeah.
If it's something you can do and you can most important afford,
Right.
and you can be there for the postoperative care.
Yeah.
We had clients that would be going away on vacation and they would just board the animal at the hospital. They're like, do the surgery when the day I drop it off, and then you can watch it and make sure it heals by the time I pick up, because the clients were very honest about it. They're like, I don't know if I can handle post-op care.
Yeah. I mean, I'm going to throw my brother under the bus here real quick. His dog had a horrible luxating patella. They waited about a year and a half. Dr. Sebastian ended up fixing it, saying it was one of the worst luxating patellas he had ever seen. And the amount of force he had to use to get it back in, he said, was insane. And then they dumped the dog off at my mom's house for 2 weeks. She's going home today. But same thing. They have 3 kids. Their house is chaos. There's no way in their mind, right, that I can recover a dog from this. And it's like,
Yeah. And I think having an honest conversation with your vet or the surgeon of what you're able to handle and what you can't, because sometimes that changes what we would recommend or what type of technique or procedure we would do.
Right.
So I think that's important.
Are those the questions you have? Because I have a couple of questions.
Yeah,
for
let's
Dr.
go.
Gassel.
Let's roll with it.
Okay. Let's talk about stem cells.
Okay.
Is that still commonly used?
Still recommended. I think it is still commonplace as a treatment. I think it's, like everything, it's just gotten very expensive. And with the ability for a lot of practices to do PRP, platelet-rich plasma therapy, which is,
Is it as good?
Yes, it can be. There are some differences, and again, it's going to be based on experience, somewhat literature and what information's been compiled across the U.S., what we hear about at meetings and talk to colleagues about. But I would say, for me, when PRP is effective and it works, it lasts about a year and then needs to be repeated.
One injection?
One injection. Again, with PRP, it's injected right into the joint.
Yeah.
Stem cell, you have the ability to do joint injections as well as intravenous injections.
Yeah.
My experience with stem cell, when it has been effective and works, seems to last closer to 2 years.
And then also the cool thing is also what I always used to do, because both of us were certified stem cell.
Yep.
Is that when it stopped working, you can give an intravenous injection of it, and it seems to kick them back in.
Yeah, I mean, for my application, if I had to re-inject, I was always doing joints along with intravenous, but I always did intravenous from the get-go as well, because they have the ability to undergo what's called homing. So you can give these stem cells at a distant site, and they've been shown to travel to sites of inflammation and damage
amazing.
and find its way there. And so when you're doing a direct joint injection, you're attacking the problem obviously directly.
Right.
Intravenously, you're sort of more of a global approach. I guess you can think of it that way.
So basically what stem cells, what we're talking about is we're talking about adult stem cells. And what you harvest it from the fat.
Yep.
And then you send it to a lab, and the lab gets all the stem cells out of there. And it's usually, so you do a surgery on a Monday, you overnight it to the lab on Tuesday. By Tuesday night, it's back overnighted to you again. So you have it in your office on Wednesday, and then you're free and clear to go. It's not embryonic stem cell.
No, it's mesenchymal-derived stem cells.
Exactly. Everyone was like, oh my gosh, embryos.
Yeah.
No, this is completely different. If you go to Europe, that's why all these athletes go to Europe for surgeries, because they use stem cells to help them heal. That's why Kobe Bryant always went, and all those high-end athletes would always go to Europe to get surgery done. Nowadays, orthopedic surgeons in human medicine tend to put bone marrow in the joint to help people heal. It's because bone marrow is full of stem cells, every type of stem cell. So it's a really rewarding thing, but again, it's the cost.
Yeah.
Crazy thing is, like when I did use stem cells, you said it goes to sites of inflammation, right?
Yeah.
Allergies would go away, ear infections would go away.
Skin problems.
Yeah, all that stuff would just disappear.
Yeah, you get some interesting
Good side effects, right?
good benefits, side effects.
And then on the human side of things is that if you have a heart attack in Europe, they immediately hook you up to a stem cell machine, and it decreases the scarring inside the heart by up to 80%.
Wow.
Yeah.
That's a really
once
significant number.
that muscle scars, it's undoing that.
Yeah.
Yeah.
Have you, for people who think something works every time, right? Stem cell, PRP, it's not a guaranteed, right?
It's not, and I spend a lot of time having that discussion with the clients. What we've seen and what we know is, keep it simple. If you take 100 dogs, 75 of those dogs will respond to the treatment.
Right.
You take those 75, and I put them on a bell-shaped curve. So bottom of the bell-shaped curve, we're not going to have much of a response. It's going to vary. Middle of the curve is pretty decent response, and then you have your outliers, which are the ones that you'll read articles in the paper about.
Right.
It's about 3% of the population. But 25% failure rate.
Yeah.
And you're going to spend thousands of dollars for that treatment. And so...
But it's always worth it.
Be prepared for that. Yep.
I've seen some amazing things with it.
Yeah.
I have too. And ones you would think, my more severe dogs, I've seen respond better than my less severe ones. It's, really remarkable. I think we're just scratching the surface.
Yeah.
The company is trying to develop, or have been for over
A
5
decade,
years now, an off-the-shelf stem cell product to where you can just, in surgery, go to your shelf, pull off, the vial, and inject the stem cells in. But it's going to be a while till we get there.
Right, because the problem is right now the way stem cells work, it comes from that animal.
Right, that's that was my first thought, is what kind of
around,
reaction issues are you going to be dealing with?
That's how they get around the FDA approval, is it's self-to-self donor.
Oh.
Okay, if you start taking your dog
Right.
and put his or her stem cells in my dog, then that becomes an issue.
Nobody wants my dog stem cells.
Well,
The awful Frenchie mix. Nobody wants that.
no one wants those.
Okay, next question I had is, what do you think of laser therapy?
Again, I think it's one of those things. It's hard to measure. I don't see the harm in doing it. I think it probably, like they've shown in people, has some great benefits.
Works on my back.
Yeah, and so then it becomes cold laser versus this laser. It's going to be, how long do you apply it for? At what wavelength? Is it going to work better over a more shallow location of a joint or an injury? Is it going to?
And I think very rarely are people doing that just laser to have the fair comparison, right? So usually I think if you're doing the same things like stem cell or PRP, most of the time you're not doing just that, right? So maybe it's a combination of all these things kind of working together, that using the laser helps with your stem cell or helps with whatever else you're doing, like with it.
Again, in my opinion, I don't see
what's the harm.
What's the harm in doing it?
Right.
So
Eastern medicine, Western medicine, combination.
Again, I think combination
Yeah.
is probably the right approach.
Acupuncture?
Benign, can be beneficial. Again, most patients undergoing acupuncture are also using other modalities and other therapies. So to measure
Like dandelion?
outcome.
Yeah.
Coconut oil?
Yeah. I think we lean on what we experience on the human side. So I tend to see people where it's it worked in me.
Right.
It's okay. That's great.
I have one story really about acupuncture. We had a doctor that did a lot of acupuncture. She was great, loved it. She was certified.
Left
did it
her
all
needles
the time.
everywhere when she was done.
Oh my gosh, all over the hospital. You found needles everywhere. We had a dog who had like the avulsion fracture in his elbow, right, and was non-weight bearing. Treated, came back. I don't know if it was who we saw, but multiple surgeries. Long story short, finally, Dr. Brower had left for the day, and Dr. G was like, we should just put needles in it. And we're like, well, you can't charge them. Like, you have no idea where you're sitting. He's like, let me go grab her book. So he grabs the acupuncture book. He's trying to figure out where to put the needle. And he put a couple needles in, and, he told them, I'm not going to charge you. I've never done this. And the flippin' dog came back almost full weight bearing, 2 days later? And I was like, no effing way. Like,
Great for his ego.
Yeah, right? I was like, no way that you are the one who actually pulled this out of doing it.
Well,
And then just like the human side, you have these one-offs where
Right.
something like that happens, and then the next thing you know, it's on TikTok and Instagram, and
Right.
so everybody wants acupuncture.
eggs might be less than $10 a dozen pretty soon, right? Now, when it comes to surgery, how long do you ever tend to send cats home on the same day, or do you prefer to keep them overnight?
I prefer to keep them overnight, but that's a lot of that has to do with the nature of the surgeries or the type of surgeries that I tend to perform. So I'm either doing, major what we'd call orthopedic procedures, or I do a lot of surgical oncology, too, where,
Cancer surgery.
big tumor removals, extensive cutting of jaws, things like that. And also the nature of our practice, we tend to have dogs that are not, these young, healthy puppies with just a small
Right.
injury. We're dealing with, geriatric patients that have confounding heart problems, other issues that really need monitoring more carefully post-op. So yes, I tend to keep, I'd say 99% of my patients one night at least.
And I think people get sad, right? They're like, oh my gosh, my dog's sleeping at the hospital. But the pain meds that you can offer in hospital versus what you are sending a patient home with are significantly better, right?
Yeah.
So yes, they may be a little sadder being at the hospital, but I guarantee you they're gorked out of their mind,
Yeah.
right? And they're
Better living through chemistry.
they're feeling good, right?
Yeah, and they're leaving the hospital, and it's not so stressful. The patients are more comfortable.
Yeah.
The owners, it's just a better experience, not just for the owner, but for the pet.
Yeah.
Yeah.
Last one I had was, and I bring this up carefully, bone cancer.
Okay.
Surgery or not to surgery? I mean, let's say, because if
He
someone
needs more specifics.
if someone
you already see the
suspects,
balls rolling.
if someone suspects of a bone tumor in a dog because of X-ray,
Okay.
and there's no evidence, radiographically, ultrasound, blood work, that it's anywhere else,
Okay.
how long do they tend to live after surgery?
Well, okay, so if it's the most common being osteosarcoma, what we've learned is that by the time you detect it radiographically at that site, approximately 93 to 94% of them have already micrometastasized.
Wow, I didn't realize it was that high.
They've already spread. We just are not going to be detecting
Right.
spread during our staging procedures, ultrasound, chest x-rays. Okay.
94%.
So then the surgery itself, which usually ends up being amputation of a limb, okay, is what we call really palliative.
Right.
So the surgery part is just removing the pain associated with the tumor at that site. Because we know if 93, 95% of it is spread already, now you need to treat the microscopic disease. And
Right.
so amputation plus chemotherapy. From there, you take those patients, again, we're always putting things on a bell-shaped curve, okay? Average is going to be about 12, 14 months. You're going to have some. I had, I always, when I have these conversations now, in my residency, I had a client who brought in a dog, had a bone tumor. We did amputation and chemo. That dog died at between 6 and 8 months after treatment.
Wow.
Okay. Her next dog came in a year later, same thing, amputation, went through chemo. I got letters from her 5 years after we did surgery that the dog was still alive.
I love
So
that.
you just don't know. I mean, you hope.
Right.
Again, it's a very personal decision.
Yeah.
And over the last decade too, now with the availability of radiation and other forms of therapy, there are some other options besides just surgery,
Right.
depending on the stage of where you're at too.
Yeah, I mean, and then can you also explain what goes into play if you're even considering amputation?
Being prepared of how your particular dog, what their quality of life is going to be. That's really
Right.
what it's about.
If it is, I mean, all dogs are three-legged animals with one to spare.
Sure.
Basically, that's
yeah,
the
you can
rule
think of
thumb.
it that way. So, we know that animals put about 60% of their weight on their front limbs already, 40 in the back limbs. So if I have an animal comes in that's going to require a hind limb amputation, they just tend to respond and do much better than animals with a forelimb amputation.
Yeah.
Also, if I have a patient that comes in that has been three-legged, meaning they've been holding up the affected leg for a couple weeks or a month, I tell owners, this is what your dog is going to look like, just removing that source of pain or discomfort for them.
Yeah.
So it's actually somewhat beneficial because they have an idea of what their animal's going to be like.
Yeah.
Okay.
But if there's arthritis in other joints and
Yeah,
stuff,
sometimes they're just not good candidates, and it's you have to have that tough conversation. I know you want to do everything,
right?
but what you're asking of your pet is probably
Your
too much.
140-pound,
Sure.
9-year-old Great Dane
Right, who
with
needs a front
horrible
leg amputation.
Yeah.
Yeah. So fortunately, there, in some of those cases, there are other options. Some do require some form of surgery, but there's limb sparing techniques and other things you can get into to save the limb, so to speak.
Do you have any other questions?
No, not right now.
Cancer
I'm good.
sucks.
Yeah.
Yes, cancer.
Yeah.
It's awful.
We did get a lot of questions about diets and stuff like that. So we will have a nutritionist come in today. We were just focusing kind of on
Great.
orthopedic
Yeah.
stuff.
You
for
don't want to ask Dr. Gassel about diets.
Are you sure?
Nah,
No?
I eat everything. Yeah. You don't
Well,
want
you could answer this one question.
that. Maybe.
What do you think of the diets that are geared towards joint health?
I think the ones that have science behind them, great.
So you're talking like your Royal Canins,
Yep.
Purinas,
Yeah.
Hills, Science Diet,
Yeah, I do.
the big brands.
Yeah, because I know that they've looked at it scientifically. It doesn't mean those other ones that are out there aren't just as good. What do they have to show me that it is?
Right.
How much is
Trust
actually
the research.
How many milligrams are actually in that serving of food?
Right.
Because they're not responsible to tell you that. or
And
prove
how
it.
many of those milligrams actually survive the cooking process?
Sure.
You're better off supplementing with glucosamine,
Yeah.
fish oils, green lip mussel, huge fan, MSM, huge fan.
Yeah.
But
And like you were saying, Adequin and Cosequin, those two brands have been around forever.
Yeah.
see, I
Right.
like Synovi. Synovi MSM was my
Yeah.
favorite
Yeah.
product.
Yep.
That was an excellent product. You can buy all these products online too. You don't even have to
it's
leave
really
the comfort of your couch.
gotten very reasonable.
Yeah.
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 Amazon.
Yeah.
Everything off Amazon.
Yeah. And I'm spoiled. We have a board certified nutritionist at our practice
Right.
who evaluates every patient that's put in the hospital and helps with the diet and
Oh my
things like that.
gosh. Look, you're spoiled. You are very
Yeah.
spoiled.
So it's shut my brain off to that.
Yeah.
Let's say you have a client that wants to start their puppy on glucosamine at 3 months of age.
Yeah.
You have any problem with that?
I don't.
You don't? Okay.
Have you heard any of the new rumors about starting animals on joint supplements to help regulate bladder issues or like the bacteria flora in the bladder?
I've heard about it, and I heard our internist talking to someone about it, but
Yeah.
it's pretty limited. I haven't done a deep dive into
Yeah.
looking at that. I mean, we have
Adequate
for years,
injections in cats.
Yeah,
works.
in cats we've used it through catheterization directly into the
So
bladder
directly
to
into the bladder.
reduce
Oh,
inflammation.
wow.
Yeah.
Okay.
Yeah.
And hopefully they don't pee it out right after you inject it.
Right.
in.
Yeah.
How long does it need to, how long should it sit in the fridge?
They leave it in. You try. And
You're
just let it
asking a
absorb it.
surgeon
That's
medicine
true, I know.
question.
I know. Sorry.
I can make stuff up.
Yeah,
What do you
just
wanna
give me
know?
a number.
But what the listeners need to know is that Dr. Gassel is not the surgeon who thinks a time to cut is a time to cure. And that's
Right.
why I love him so much. He's able to sit down and have these crucial conversations with clients and even tell them it's not worth it. I mean, I've had so many clients that used to come to me and said, "You're right. he gave me other options.
Yeah.
And it's so, I mean, that's in my heart for my clients. I want to say thank you for all that.
Thank you. I
Yeah.
appreciate that.
That
Yeah,
meant the world.
we referred to you all the time, and I mean, I can't even tell you how many times I've emailed you or texted you X-rays over from the clinic. She's like, I don't know, send it to Gassel, send it to Gassel, send it to Gassel.
Yeah.
But we're lucky that we had you as a resource. And for people who are listening, if you can find a great surgeon, I mean, have an open conversation with them, right? Because most good surgeons will sit and actually have a real conversation with you, or most good doctors, right, will sit and have a real conversation with you about your options.
Yep.
Maybe that comes with age.
Yeah, maybe. You're just
Age.
Wisdom.
yeah, you're just getting old now.
Well, yeah. Well, your barber and my barber are the
That's
same.
right. Sam.
They're friends.
Same.
Yes.
Yeah.
And in your matching shirts today,
Yeah.
you guys look
Well,
so
thank you for
spiffy.
having me and giving me the opportunity. And this is great.
Oh, well,
Hopefully
we're
it
going to have
helps.
you back. Don't think this is a one and done, young man. Yeah, we got to get into anal sac tumors and all those other fun things. But right now, we're just going to keep it simple because we've had so many questions from our listeners about limping.
Yeah.
And supplements, and what should I do? And the real answer is, in my opinion, is that no one really has a crystal ball. We can't tell you exactly how things are going to turn out.
Yeah.
We can tell you off of statistics from research what will be the best answer, but we still can't give you a definite answer.
We'll end with that. Thank you guys for joining us on this episode of Irreplaceable Tails, and we'll see you next time.
We'll see ya.
Bye-bye.